2 hours ago, the White House declared war on affordable medicine. President Trump signed an executive order placing Canada's largest pharmaceutical manufacturers on a federal sanctions list, blocking their access to American financial systems and threatening criminal prosecution for executives who continue trading with United States healthcare providers. The justification? Canada's refusal to abandon price controls that keep insulin and cancer treatments affordable for its citizens. Treasury Secretary Scott Bessent called it a necessary response to what he termed pharmaceutical piracy. The executive order accuses Canadian drug manufacturers of violating American intellectual property rights by producing generic versions of patented medications at prices that undercut American pharmaceutical companies. The White House framed this as protecting innovation and American jobs in the biotech sector. But this was not about patents. This was about profit margins. American pharmaceutical companies have been lobbying the administration for months to force Canada to eliminate price regulations that keep drugs affordable. When Canada refused, Washington weaponized the financial system. The order freezes assets, blocks transactions, and threatens executives with prosecution under anti-money laundering statutes if they continue supplying American hospitals and pharmacies. The pharmaceutical industry celebrated. Patient advocacy groups panicked. And Mark Carney was ready. Within 90 minutes, he walked to a podium in Ottawa and delivered a response so precise, so devastating in its moral clarity and strategic calculation, that 3 senior White House advisors reportedly told colleagues, "We just gave him the entire moral high ground and a loaded economic weapon." The order's real impact. Let's be absolutely clear about what this executive order actually does. It does not protect American innovation. It blocks Americans from accessing affordable medicine produced by one of their closest allies. Canada supplies 35% of all generic pharmaceuticals consumed in the United States. That includes insulin, chemotherapy drugs, antibiotics, and essential medications that millions of Americans depend on daily. The order has 3 components. First, all Canadian pharmaceutical manufacturers are added to the specially designated nationals list, the same category used for terrorist organizations and hostile regimes. Their assets in American financial institutions freeze immediately. Second, any American entity conducting transactions with these companies faces secondary sanctions. That means hospitals, pharmacy chains, and distributors risk losing access to American banking if they continue purchasing Canadian drugs. Third, executives of Canadian pharmaceutical companies are subject to arrest if they enter United States territory. For companies like Diabetics, which supplies insulin to over 8 million American diabetics, this is an existential crisis. They can continue serving American patients and face financial destruction, or they can comply and watch millions lose access to affordable medication. The White House calculated that Canada would fold within days. They assumed Canadian pharmaceutical executives would pressure Ottawa to negotiate quietly, accepting American terms to preserve market access. They assumed Carney would prioritize industry over principle. They were catastrophically wrong. Washington's fatal assumption. The Trump administration's entire strategy rested on one belief: healthcare is too critical to weaponize. No leader would risk being blamed for a medical crisis affecting millions of vulnerable patients. Canada would blink first, because the moral cost would be unbearable. But that assumption misunderstood something fundamental. Carney was not the one weaponizing healthcare. Trump was. And Carney was about to make absolutely certain the world understood that distinction. Washington expected panic calls from Canadian pharmaceutical CEOs. They expected emergency meetings where industry leaders begged Ottawa to find a compromise. They expected Carney to quietly offer concessions while publicly maintaining defiance for domestic audiences. None of that happened. Carney's moral and strategic masterstroke. Here is what Carney actually did. 90 minutes after the executive order became public, he convened an emergency session of Parliament. He walked to the podium, flanked not by trade officials or industry representatives, but by the Canadian Minister of Health and 3 patient advocates, including a type 1 diabetic teenager and a cancer survivor. The visual was deliberate. This was not a trade dispute. This was about human lives. Carney spoke for exactly 14 minutes. He opened with numbers that made every healthcare professional in North America sit up. Canada produces 35% of the generic pharmaceuticals consumed in the United States. We do this because our regulations prioritize patient access over corporate profit. American pharmaceutical companies charge $300 for a vial of insulin that costs $8 to produce. We sell it for $32. Not because we steal their patents, but because we refuse to let patients die for shareholder returns. Then he made the announcement that sent shockwaves through every hospital and pharmacy in America. First, effective immediately, Canada is suspending all pharmaceutical exports to the United States, pending a comprehensive national security review. Not reducing. Suspending. Insulin, chemotherapy drugs, antibiotics. Every medication currently flowing south stops until Canada determines whether the United States government will continue using trade policy to threaten Canadian sovereignty over health care. Second, Canada is reallocating pharmaceutical production to serve domestic needs first, then allied nations through the World Health Organization's Essential Medicines Framework. Excess capacity currently serving American markets will be redirected to countries that respect Canada's right to regulate drug prices in the interest of public health. Third, Canada is fast-tracking partnerships with the European Union and India to establish alternative supply chains for essential medications. The agreements were already negotiated. Carney just activated them. Fourth, and this is the one that made Washington go silent, Canada is offering humanitarian exemptions. Any American patient unable to afford medication due to this crisis can access Canadian supplies through a direct government program. Not through American pharmaceutical companies, not through American insurers, directly from Canada to patients. Carney said, and these words were broadcast live across North America. We will not let American patients suffer because their government chose pharmaceutical profits over human lives. Any American who cannot afford insulin, cancer treatment, or essential medication can contact Canadian health authorities directly. We will ensure they receive it. We will not negotiate our values, but we will not punish patients for their government's choices. The chamber erupted. Every member of Parliament stood. The opposition leader, who had criticized Carney on healthcare policy just last month, applauded. The teenage diabetic standing beside Carney was crying. And in the United States, within 20 minutes, patient advocacy groups were sharing the announcement across every social media platform. The American healthcare crisis begins. Now here is why Washington is in absolute freefall. The executive order was supposed to pressure Canada's pharmaceutical industry. Instead, it triggered a medical supply crisis across the United States. Canada supplies 35% of generic drugs, but the distribution is not even. For insulin specifically, Canada provides 52% of the supply entering American pharmacies. For certain chemotherapy drugs, the number exceeds 60%. These are not luxury items. These are life-sustaining medications. American hospitals operate on just-in-time inventory systems. Most facilities maintain 72 to 96 hours of critical medication reserves. When Canadian shipments stopped, the clock started ticking. Within 3 days, hospitals in border states began reporting shortages. Within a week, the crisis spread nationwide. 38 million Americans live with diabetes. Roughly 18 million depend on insulin daily. If half of the insulin supply disappears, rationing begins immediately. Patients start skipping doses. Emergency rooms fill with diabetic ketoacidosis cases. People die. Cancer patients face similar math. Chemotherapy requires precise dosing schedules. Delays increase mortality risk significantly. When hospitals run out of specific drugs, oncologists face impossible choices about which patients receive treatment and which wait. The American Diabetes Association issued an emergency statement within 6 hours, calling the executive order a direct threat to millions of American lives. The American Cancer Society followed, warning that disrupting pharmaceutical supply chains would result in preventable deaths. But what truly panicked the White House was the public response. Carney's offer of direct patient assistance went viral. Within 24 hours, over 400,000 Americans had contacted Canadian health authorities requesting access to affordable medication. The optics were devastating. American citizens bypassing their own healthcare system to receive humanitarian aid from a neighboring country. One diabetes advocacy group posted a video of a mother explaining that her son's insulin costs $340 per vial in the United States and $32 in Canada. My government just sanctioned the country trying to keep my son alive. Think about that. The pharmaceutical industry turns. Here is where the strategy completely collapsed. Trump assumed the pharmaceutical industry would support the executive order because it protected their pricing power. But the industry is not monolithic. Brand name manufacturers cheered. Generic producers, distributors, and pharmacy chains panicked. CVS, Walgreens, and major hospital networks depend on Canadian generics to maintain affordable drug access. Their entire business model assumes access to competitively priced medications. If Canadian supplies disappear and they are forced to source exclusively from American brand name manufacturers, prices spike across the board. Patients cannot afford medication. Insurance claims skyrocket. The system fractures. Within 48 hours, the National Association of Chain Drugstores called for immediate rescission of the order. The American Hospital Association warned that hospital pharmacies would face critical shortages within days. The Generic Pharmaceutical Association, representing American manufacturers, stated that domestic production capacity cannot replace Canadian imports in under 18 months. Even brand-name pharmaceutical companies began distancing themselves quietly. Executives told the White House privately that public blame for the insulin crisis would destroy their reputations permanently. One CEO reportedly said, "We wanted price protection, not a dead diabetic child on the evening news with our logo in the background." These are not Canadian lobbyists. These are American healthcare institutions telling their own government that this policy will kill American patients. The international humanitarian response. The World Health Organization issued a statement within 24 hours expressing grave concern about the weaponization of essential medicines in trade disputes between allied nations. The language was diplomatic, but the implication was clear. What the United States did violated international norms around access to health care. The European Union went further. The European Medicines Agency announced it would fast-track approvals for Canadian pharmaceutical exports to EU markets, explicitly stating that access to affordable essential medications is a fundamental right that should not be subject to trade retaliation. India, the world's largest generic drug manufacturer, released a statement supporting Canada's right to regulate pharmaceutical pricing and offered to increase exports to Canada to offset any supply disruptions from halted American trade. Even the United Kingdom, traditionally cautious about criticizing Washington, issued a statement noting that healthcare policy should be determined by medical need, not trade leverage. Canada was not isolated. The United States was. And the isolation was not just diplomatic. It was moral. The international community watched America sanction a country for making medicine affordable, then watched that country offer to provide medication directly to suffering American patients. The contrast could not have been sharper. Trump's impossible choice. So where did this leave the White House? 3 options, all catastrophic. Option 1, enforce the sanctions and own the healthcare crisis. Insulin shortages spread nationwide. Cancer patients miss treatments. Preventable deaths occur. And every single one gets blamed on the administration that sanctioned affordable medicine. Swing states with high diabetes rates, Pennsylvania, Michigan, Wisconsin, all face voter fury. This is not abstract economic pain. This is people watching family members ration insulin. Option 2, quietly rescind the order and admit defeat. That signals to every other nation that American threats are hollow when moral clarity opposes them. It emboldens every government facing American pressure to simply wait Washington out. And it hands Carney a complete victory, proving that standing firm on principle works. Option 3, escalate further with additional sanctions or threats. That pushes Canada deeper into partnerships with the EU and India, accelerates the construction of alternative supply chains that bypass America entirely, and makes the United States look like it is willing to let its own citizens die to punish a neighbor for affordable health care. None of these options deliver what Trump wanted. He wanted Canada to abandon price controls and accept American pharmaceutical pricing. Instead, He got a humanitarian crisis, international condemnation, and a domestic political disaster. The strategic catastrophe. What should genuinely terrify the White House is that Carney did not improvise this response. The EU and India partnerships were negotiated months in advance. The Direct Patient Assistance Program was designed and ready for activation. The parliamentary vote had cross-party support before the crisis even began. Canada saw this coming. They knew American pharmaceutical companies were lobbying for exactly this kind of pressure. They built contingency plans, negotiated alternative markets, and prepared a response that would turn economic coercion into moral clarity. One senior Canadian health official told the press anonymously, "We knew they would try this. We knew they would weaponize access. So we built a system where we could cut them off without hurting patients. We made it so the only people suffering would be American citizens betrayed by their own government's greed." 2 hours ago, the White House thought it was protecting American pharmaceutical profits. 2 hours later, it is facing a healthcare crisis, international humanitarian condemnation, and a political disaster in swing states filled with diabetics, who just watched their government sanction affordable insulin. Trump wanted Canada to surrender healthcare sovereignty. He got American patients seeking humanitarian aid from Canada. He wanted to prove America could dictate terms. He proved that moral authority matters more than market leverage. He wanted submission. He got a master class in how to turn economic aggression into ethical catastrophe. Mark Carney did not just counter the sanctions. He turned them into the single most politically toxic decision of Trump's presidency. And he did it by offering insulin to diabetic Americans, while their own government tried to make it unaffordable. Washington wanted a trade victory. It got a humanitarian disaster with its name on it.